The federal government has funded primary health networks with regions that have been impacted by bushfires, various funding, and this funding is to improve mental health support services to bushfire affected communities and turn it into a self-referral process where they don't have to go via their GP to get a mental health treatment plan. They can go directly to a primary health network commissioned mental health service. For us up here in the New England area, that's Healthwise. They've been doing a great job at providing mental health services to our communities who have been impacted by the bushfires.
So Healthwise are passionate about the health of small communities. We've got a fairly big footprint that we cover, lots of offices, but you know, we tend to reach out to those small communities and do the best we can.
We really, as an entity at Healthwise, really have a lot to offer.
Healthwise has been able to offer counselling for bushfire and drought affected communities, and on our website there are self-referral forms so people don't have to go to their GP. It's really important that we keep the GP in the loop, so the GP is always involved in the process, but you don't need a GP referral. You can just jump onto the website, send in the form and access some mental health services.
So having our self-referrals for fire and for drought and having Healthwise on the ground as well when they've been able to with COVID has been just amazing. So for a lot of our smaller communities, trying to get a doctor's appointment is an absolute nightmare. So being able to work yourself up into these systems are so helpful, and the self-referrals have been brilliant.
At a personal level and from Waitalaba, we had the 8th of the November 2019 bushfires, which wiped out our whole community. 2 of our community members died. My grandson-in-law was severely burnt. My granddaughter lost everything. She had a little baby, and you know, and my son lost everything, and my friends lost everything, and it was just a nightmare. Because of my role as mayor, I had so many other people to think about, and plus my family as well. I didn't really think of myself as needing help. I thought I was coping quite well, really, until I had started to get a bit of the physical symptoms of stress. And with Healthwise being there, I just thought one day, I think I need to see a counsellor. I think I really need to have somebody to talk to let out, because I was under all sorts of pressures. The process was I called into Healthwise to the office there one day, and I said, I think I need to see a counsellor. And I filled out the form, which was pretty easy, nothing bad about it. It was quite an easy thing to do. Yeah, that's how it started. I've had about 5 now, and it's been very, very helpful. It has given me confidence, just having somebody to talk to, knowing that it's not going to go anywhere else, that the counsellor is somebody that I can trust. I recommend Healthwise. I recommend the office in town. I say to people, you can access Healthwise. You can just walk in off the street, and the person there will see you and direct you into the right direction if she can't help you. And it's so good having that access in a community. It's what we need. It's what I really wanted for our community right at the very beginning. This is a wonderful thing, and I'm so pleased that the PHN has supported that opportunity for people in our community.
For more information about the bushfire services that the PHN support and provide, please visit our People Bank website.